I will try to go very quickly because I think it's a short time, to finish my presentation. Okay, I am working in the Department of Health, but I am working together with the Department of Welfare, and here in the room we have the Deputy Director of the Department of Welfare, and we are trying to develop some kind of model of integrated care in home care. I think maybe a quick overall framework about the situation in Catalonia. You could see we have the Department of, on the right, we have the Department of Health, and to the left we have the Department of Welfare with different kind of organization. We have universal coverage. In the case of the social services, it is compulsory to have some kind of co-payments and different kind of organization. In the case of home care, we have the home healthcare services. They are on the right, and the home help or social care home help, it's on the left. The situation we have in Catalonia, we have a lot of elderly population, but maybe the most important feature, it is the intensity of the process of aging is very intense. I think in the way you could see, we will have, in the middle of the century, we will have about almost 40% of the population will be over 65, and in the cases over 80, we will have almost 15% of the population. I think the process of aging is very high. In the case of Catalonia, you could see the pyramid. We don't have a pyramid, it's a tunnel. I think the situation of the picture is a very intense process of aging. A very good thing we have in Catalonia, we have the possibility in the health sector to have an aggregate database of all the multimorbidity. For example, we are collecting all the information from primary health care, mental health, hospital care, and long-term care facilities, and we are aggregating. It's possible to make a stratification and to calculate different kind of indicators. Till now, we don't have the minimum data set of social services, but we are in conversations to have some kind of formal agreement between the two departments and to have an aggregate database of both the departments. Okay, you could see one of the consequences of to have this kind of aggregate database is this kind of picture. That is, on the left, that is the picture of the multimorbidity burden situation in Catalonia. Here you could see the red color is multimorbidity. The darkest color you see, the more multimorbidity the patient has, I think you could see. But I think it's very interesting not only to have the general picture of all the population of Catalonia, but also to have the picture of the population who receive home care. And here you could see the level of multimorbidity of the patients, of 100,000 patients who receive home care in Catalonia. It's possible to have different kind of pictures related to different kind of diseases, but for example, in the case of Catalonia, it's possible residential care, advanced chronic disease, and complex patients. I think we have established some kind of conditions, and we have the registration of this kind of conditions, and it's possible to have this aggregate data and this kind of picture related to this kind of situation. Another important consequence to have this database aggregate is to know about the emergency admission rate related to this kind of conditions. You could see general population at the bottom, and you could see in comparison, in the case of home care, it is at least one emergency admission every year. I think in the case of advanced chronic disease is almost 80 admissions per 100 persons with this kind of condition. Okay? Another important thing is to have the different kind of disease related to this kind of home care patients. In the case of home care patients, we have almost two-thirds of these patients, they have complex needs. They are complex patients with multimorbidity or advanced chronic disease. Another thing is the multimorbidity burden. It's possible to calculate in the case of the general population. You could see here this figure. In the case of home care, it multiplied by 5-fold this kind of multimorbidity score related to this burden of multimorbidity. Another important thing, that is the general distribution of multimorbidity and risk of general population. And here you could see that is the distribution of risk of the population who is in home care. It's possible to know, you could see here, the burden of multimortality of this kind of population. 65% of home care populations is very complex in terms of multimortality. Okay. Concerning regarding the Department of Welfare, we have this kind of figures, we have this kind of coverage. We have almost 5% of the population over 65 is covered by this kind of home health services. In the case of Telecare, basic Telecare, in social care, we have over 10% of the population, between 10 and 12% of the population is covered by this kind of Telecare at home. And you could see here, which is the situation we have in Catalonia, and maybe everywhere, I think. You could see here, we have primary health care, we have social care services, we have emergency services at night, and different kind. It's possible to have maybe 20 different kind of organizations could work with the same patient. It's not the same everywhere, but maybe it's very normal, very usual to have maybe 5, 6, 7 different kind of organizations working with the same patients in a concurrent time, no? With different kind of information system, commissioning scheme, financing schemes. It's very difficult to manage this kind of situation. We know about the preference of the patients who are in the community, and we know by the last studies, we don't have a lot of studies about this kind of thing, but one of the last studies we have, most of the population want to stay at home. A very important thing about policy and governance, we have a health plan. Health plan, it is the main health driver to establish some kind of special framework to work in the agenda of integrated care for the health sector. And you could see here, number one, it's a patient-centered approach, integrated care and chronicity, and it is the first time we think our health plan, we have this kind of interdepartmental approach to have this kind of integrated care in the case of home care. Another important thing, we have this kind of integrated plan between the Department of Welfare and the Department of Health. And one of the projects we have, it is this project of home care or integrated home care, and we are working in this kind of design. Okay? Very important thing, it's the governance. If we would like to have this kind of initiative to integrate the home care, it's very important because we have two departments and the power of the local government. And I think it's very important not only to have this kind of governance at the top, but also at county level, at meso level, to have this kind of organization. And in some parts of the country, we have established this kind of governance, or different kind of issues related to this kind of thing. I think it's very important to involve the representative of the Department of Welfare, the Department of Health, and the commissioning agency, Catalonia, in this kind of approach. And in the case of the local government, they have competence in social services. It's important to be involved in this kind of thing. Okay, that's some of the operational committees, the people, but I think it's important to have this kind of governance. That's the way the leaders, the clinical leaders and the professionals could work and could establish this kind of agenda. One of the things we have made some kind of progress is to have a new definition of home care. We have agreed and make a consensus of a new definition of home care. Here you could see home care understood as health and care or social care provided to a person in the place he lives, to have a maximum level of health, well-being, quality of life and autonomy. I think it's important to have this kind of new vision in the program and in the plan we are developing. A very important thing is we have this kind of mess. The proposal we are making for Catalonia is to have this kind of approach, to reorganize and to redesign this kind of thing. I think it's very important to establish the primary health care and the basic social care services. They are the basis, it's the hub where the home care should be organized. And in this kind of hub, you could articulate and you could activate the different kind of services who should work very collaboratively in this kind of issue. Okay? A very important thing we have developed, we have started to identify people with complexity from the health sector. We have established these two kinds of conditions. One is complex patients, especially people with multimorbidity. Another kind of condition, it is advanced chronic disease. We have established this kind of new conditions. It's possible to register and to share and publish and share this kind of information in a Catalan shared electronic health record. It's possible to share this information, and it's possible to generate from the primary health sector this kind of minimum plan related to the patient. Here you have a basic information, it's a key information summary related to different kind of very basic issues about diagnostics, what to do in case of crisis, and the advanced care planning, especially with people with advanced chronic disease. We have some part of the document related to social services utilizations, but you should put all the information here. The idea in the future is to aggregate automatically this kind of information from the station, from the record, or the electronic record from the social care. That is the situation. It's possible to publish from primary healthcare this kind of information. We have between 2 and 3% of the population with this kind of condition, and it could be shared in the shared clinical record. And the next step is to have, we know a lot about the complexity in healthcare, and we are working in the Department of Health in the cases of complexity in social care. It's a very new thing, and we are very happy to progress in this kind of agenda. Another important thing is to have different kind of criteria related to this kind of integrated home care. We have complexity, intensity of support, but it's very important in the center this kind of concurrent health and social care needs. If one patient, a person has this kind of concurrent health and social care needs, it's the principal, the main target to be achieved in this kind of integrated health model. It's a health and social complexity related to this person. Okay, we are working in a case conference document. We are publishing in the next weeks this kind of documents related to the case conference methodology related to this kind of approach. And we have started to work in a new redesign of the processes. We have made this kind of exercise to have some kind of new flow approach related to integrated care in home care. It's a main and general approach, and it should be adapted in every country between the health and the social care sector to adapt to the specific situation of every country. But we have worked at macro level in this kind of general approach and redesign of this kind of thing. For example, related with welcome, assessment, planning, execution, follow-up, and closing. That is our health strategy. We have at the Department of Health, we have a personal health folder, electronic health record, it's a national electronic health record, and we have a first experience in the area of Barcelona, in the city of Barcelona. We have started to share health and social care data. Here you could see what kind of information we are sharing. For example, it's information about the diagnosis, information about the degree of dependence, and different kind of social care problems, different kind of things related with the same patient. This kind of information, it is shared when the patient, the person, give the consent. It's not possible if the patient don't give the consent, and we have started only in the area of Barcelona, but the idea is to extend this kind of initiative to the rest of the country. Here you could see that is a screen of this kind of initiative. It's very important to establish the same identification number. It is expected to develop a new regulation to facilitate to share this kind of information. It's required an agreement between the partners in the health and in the social sector, and the person consent. And we are working now with the Department of Welfare and the Department of Health to share this kind of information without the need of this kind of consent. The idea is to progress, to work in this agenda. A very important thing when we are talking about social services, in the case of the social services, there is no any kind of international codification of the social problems. We are working in agenda to establish some kind of identification codes which could be interoperable in the case of electronic health record. And we have established with an office of standards, we have in Tixalut, in an ICT office, to establish this kind of basic minimum data set related to this kind of social problems. Yes? Okay. You go very quickly. Another important thing is about the complex needs. We are working to validate. We know a lot about complex health, but we don't know about complex social needs. And the idea is to establish some kind of assessment. We are validating an instrument to have this kind of approach to social complex needs. Okay, different kind of initiatives. In the case of discharging reports, it's possible to send a message to the primary health care when a patient is referred from the hospital, and the primary health sector could receive this kind of information in the clinical station related to this kind of issue. Different kind of indicators. Here you could see we are calculating the emergency admissions in every county. Here are the 40 counties we have in Catalonia. For example, you could see here, that's our Torba in Catalonia, it's La Garrotxa, with a very good level of integration of health and social. You could see here with very good outcomes related to this kind of indicator. Okay, I'm finishing. Okay, thank you.
We actually don't have any time for questions just now. If anybody has desperate to ask a question, perhaps ask after the session. But I actually found your graphs, your figures, I'm a junkie for all that. I thought it was fabulous. Moving from strategy down to individual care plans and integrated care plans. Fabulous. Lots to be learned from those. So thank you very much.